Hello everyone, how are you guys doing? I never imagined that this would be one of the toughest questions to ask. Look at the situations we are in. How are we doing? If we're doing good, we should consider ourselves very, very lucky. And it's not an exaggeration, isn't it? So, anyways, let me share the objective of making this video before I speak my heart. I wanted to share a recent editorial which has been published in a reputed international journal, Lancet. In fact, while I was going through that article just a couple of minutes prior, I had tears in my eyes. I know most of us are having our own personal challenges for the past 1 year, losing loved ones, losing friends, neighbors, and so on. But looking at the current scenario, the emergency which our country is facing, it's really unimaginable. We never anticipated these things to happen. We are not prepared. That's the reason why we're seeing all these deaths. We're seeing scarcity of essentials. We're losing loved ones in the process. And our healthcare system is completely exposed. So I know this is all something which we are already aware of, but the main reason or the intent why I'm making this video is for two obvious reasons. Number one, to share information, not misinformation, to share information. And second thing is, once we are aware of this information, each one of us in our own capacity or as group of people or as a society or a government, we can do something in order to overcome this current challenge, which is an emergency which we're facing right now. So let's look into that editorial, which is published today, May 8th, the recent issue of Lancet, the editorial page. We'll go through that information. Even though there is criticism, of course, we need to welcome criticism. And that's the reason why, if you're not ready to accept criticism, then how do you know that we're doing it in a right way or in a better way? So we need to welcome criticism, should not take it personally. At the same time, we need to find out solutions, which is very, very important in order to save lives, isn't it? So with these objectives in mind, I'm making this video, and I request all of you to share this article widely and look towards finding solutions. And yes, we can do something in our own capacity to overcome the current pandemic. So this is today's publication. It's a weekly publication, if you know, Lancet. So in today's publication, May 8th to May 14th, as you can see in the editorial page, they have mentioned the following: India's COVID-19 emergency. So this is just an abstract. India squandered its early successes in controlling COVID-19. India must now restructure its response while the crisis rages. The success of that effort will depend on the government owning up to its mistakes, providing responsible leadership and transparency, and implementing a public health response that has science at its heart. So let's look into that editorial now. Yeah, so this is the editorial which I was talking about, and as I said, as I was going through this editorial, I literally had tears in my eyes. I know it's a very negative thing that's happening out there, but it doesn't mean that we should avoid the same. We should be able to accept the reality and work towards solutions if we are looking to progress and ultimately save ourselves in this process, isn't it? So India's COVID-19 emergency. The scenes of suffering in India are hard to comprehend. As of May 4th, more than 20.2 million cases of COVID-19 had been reported, with a rolling average of around 3,78,000 cases a day. In fact, we crossed even 4 lakh mark, which is very unfortunate. Together with more than 2,22,000 deaths, which experts believe are likely to be substantial underestimates. We all know this. Hospitals are overwhelmed and health workers are exhausted and becoming infected. Social media is full of desperate people, doctors and public seeking medical oxygen, hospital beds and other necessities. Yet, before the second wave of cases of COVID-19 began to mount in early March, Indian Minister of Health Harshvardhan declared that India was in the end game of the pandemic. The impression from the government was that India had beaten COVID-19 after several months of low case counts, despite repeated warnings of the dangers of a second wave and the emergence of new strains. Modeling suggested falsely that India had reached herd immunity, encouraging complacency and insufficient preparation. But a sero survey by the ICMR, Indian Council of Medical Research, in January suggested that only 21% of population had antibodies against SARS-CoV-2. At times, Prime Minister Narendra Modi's government has seemed more intent on removing criticism on Twitter than trying to control the pandemic. Despite warnings about the risks of super spreader events, the government allowed religious festivals to go ahead, drawing millions of people from around the country, along with huge political rallies, conspicuous for their lack of COVID-19 mitigation measures. The message that COVID-19 was essentially over also slowed the start of India's COVID-19 vaccination campaign, which has vaccinated less than 2% of the population. At the federal level, India's vaccination plan soon fell apart. The government abruptly shifted course without discussing the change in policy with states, expanding vaccination to everyone older than 18 years, draining supplies, and creating mass confusion and a market for vaccine doses in which states and hospital systems competed. The crisis had not been equally distributed, with states such as Uttar Pradesh and Maharashtra unprepared for the sudden spike in cases, quickly running out of medical oxygen, hospital space, and overwhelming the capacity of cremation sites, and with some state governments threatening those asking for oxygen or a hospital bed with national security loss. Other states such as Kerala and Orissa, in fact, this is something which is, I can say, something better, something positive. States like Kerala and Odisha are better prepared and have been able to produce enough medical oxygen in this second wave to export it to other states. India must now pursue a two-pronged strategy. First, the botched vaccination campaign must be rationalized and implemented with all due speed. There are two immediate bottlenecks to overcome. Number one, increasing the supply, some of which should come from abroad, and setting up a distribution campaign that can cover not just urban but also rural and poorer citizens, who constitute more than 65% of population, or over 800 million people, but face a desperate scarcity of public health and primary care facilities. The government must work with local and primary healthcare centers that know their communities and create an equitable distribution system for the vaccine. And second strategy is India must reduce SARS-CoV-2 transmission as much as possible while the vaccine is being rolled out. As cases continue to mount, the government must publish accurate data in a timely manner and forthrightly explain to the public what's happening and what is needed to bend the epidemic curve, including the possibility of a new federal lockdown. Genome sequencing needs to be expanded to better track, understand, and control emerging and more transmissible SARS-CoV-2 variants. Local governments have begun taking disease containment measures, as we're all aware, but the federal government has an essential role in explaining to the public the necessity of masking, social distancing, halting mass gatherings, voluntary quarantine, and testing. Modi's actions in attempting to stifle criticism and open discussion during the crisis are inexcusable. The Institute of Health Metrics and Evaluation estimates that India will see a staggering 1 million deaths from COVID-19 by August 1st, 2021. If that outcome were to happen, Modi's government would be responsible for presiding over a self-inflicted national catastrophe. India squandered its early success in controlling COVID-19. Until April, the government's COVID-19 task force had not met in months. The consequences of that decision are clear before us, and India must now restructure its response while the crisis rages. The success of that effort will depend on the government owning up to its mistakes, providing responsible leadership and transparency, and implementing a public health response that has science at its heart. Yes, these are harsh words. Yes, that's criticism. And of course, yes, we need to take it. Look at what's happening right now. And we have solutions. That's a good news. We have solutions. So vaccinations, so there are certain solutions which are at central level, state level. But at the individual level, let's hope they open their eyes and start taking measures in that direction. Trying to save as many lives as possible. It's never too late. And secondly, at individual level, we can definitely do something in our own capacity. Masks, social distancing, hand hygiene, avoiding unnecessary travel, and various other measures are being widely circulated in ICMR website. You can even follow CDC website, WHO website. If we can take precautions, at least from our side, and take care of ourselves and our family members in the process, will not be just another statistic, right? So it's very challenging. As I was going through that editorial, I felt so much pain. There's a lot that's happening out there, which has been aptly put in that editorial. I know those are harsh words, but someone needs to provide us some constructive criticism, which is really necessary at the moment. It's not just about controlling opposition. It's not just about shutting people in the name of politics, in the name of religion, in the name of some nonsense. Rather, we should allow, a healthy democracy should allow everyone to express their opinion at their own level, and should be able to, ultimately work towards the benefit of the people. That's what a functioning, healthy democracy always looks like. So I request all of you to take care of yourself and your family members with the current pandemic. And whatever you can do at your individual level, try giving your best, provide a service accordingly. And most importantly, I'm not going to tell you to avoid negativity, but yes, let's get to know all these facts, but let's not get carried away. Rather, let's work towards solutions and see what best we can do to provide solutions at our own level, at our own capacity. And I'm sure that the policymakers at center and state level are going to open their eyes before it's too late and do the needful. Let's just hope for the best, and not just hoping for the best, and let's do something in our own capacity to overcome the current pandemic. India is facing an emergency, and I'm sure we all have that strength to overcome this current emergency.